At PT Solutions, one of the most common injuries we tend to see at our clinic is knee pain. When evaluating and treating knee pain, we tend to look at whether or not the knee pain is on the outer part of the knee, the inner part of the knee, or below the kneecap. So when we talk with our patient, we kind of try and talk with them about more or less where that pain is coming from. And then from there, we can kind of decide whether it's a more mechanical issue or whether it's a lateral knee pain issue. Mechanical knee pain. One of the most common places you tend to have pain with mechanical knee pain tends to be on the inner part of your knee and right below your kneecap. The reason we call it mechanical is a lot of times the patient will have faulty body mechanics. With that saying, a lot of times their hips tend to be a little bit more weaker, so their knees tend to turn inward. So the way we kind of work with that is we really focus on strengthening the hips. What I tell my patients is your hips are going to be the foundation of your house. You have to have a strong foundation to have a strong house. So we really focus on strengthening those hips to kind of reduce some of the internal forces on the inner part of that knee. In addition to that, we also work with some of the soft tissue restrictions and some of the joint restrictions to kind of alleviate some of the pain that they're going to have going up and down steps and just some of the activities that we may be doing in the clinic. Lateral knee pain tends to be a constant dull ache on the outer part of the knee joint. The interesting thing about this is a lot of patients don't know that that pain actually comes from their back. The way we treat this is we mobilize the lumbar spine, focus on some of the soft tissue restrictions, and once that's been resolved, we focus on specific strengthening exercises to work on different muscles to kind of prevent this from happening in the future. The most important thing, regardless of whatever knee pain you may be experiencing, is you want to make sure you get checked out by a primary care physician, an orthopedic physician, or your local physical therapist.